Napak is one of the 9 districts in the Karamoja sub-region in the northern Uganda. It was carved out of Moroto district in 2010. It is bordered by Abim district in the northwest, Kotido in the north, Moroto in the northeast, and Nakapiripirit in the southeast. Katakwi in south, Amuria in the southwest, and Otuke in the west, with 6 sub-counties, namely Iriri, Lakopo, Matani, Nyongaret, and Lepi. The district headquarters at Napak are located approximately 340 kilometers by road northeast of Kampala, the capital of Uganda. The national census of 2012 estimated the population of the district at approximately 197,700. Cattle keeping is the main economic activity, supported by small-scale crop farming of the majorly nomadic people. Dr. Alfred Muwangizi, the Acting Assistant Health Services for Vector-Borne and Neglected Tropical Diseases and the Head of Vector-Borne and Neglected Diseases Department, says that Uganda is still suffering from neglected tropical diseases that result from poverty and poor living conditions.
Most of these diseases actually, they are transmitted through dirty water. Others, because of poor hygiene, because as I said, it normally affects people. They affect people who are of low socio-economic status. So in most cases, you find those people, also their sanitation and hygiene is poor. So with the government, we work with the other partners, the WASH project, to improve the sanitation. Because like for example, jiggers. The solution is to improve the sanitation, hygiene and sanitation. Yes. So this is, of course, this has been done by the government and also with support from partners.
This one, even if we use the comb, because they are severe.
Jiggers, also known as tungiosis, has for long been known to affect the Busoga sub-region, but with a countrywide survey by Innovation for Tropical Disease Elimination, Ifortrode, it was concluded that jiggers is much more endemic in Napak than elsewhere in the country. The prevalence was over 70% of the general population. The same baseline survey also discovered that the people of Napak also suffered from scabies and non-Filaria elephantiasis, scientifically referred to as podoconiosis.
Podoconiosis is a medical term for a swelling of the feet. In a lay language, it is called elephantiasis. Elephantiasis is caused in 2 ways. One, the first one, the most common, is caused by an infection by a Filaria worm in our blood, and this Filaria blocks lymphatic systems, especially of the lower limbs, and once the lymphatic systems are blocked, then the lymph accumulates in the legs and the legs swell. But this podoconiosis is not caused by Filaria worm. It is caused because of as a result of reaction to the soils, the type of soils which are available in the Karamoja are the ones which are directly causing. Actually, it is a reaction to the soil.
Actually, our primary focus is in 3 parishes of Napak district. However, there are continuous calls from us to extend other areas. So we get reports of people dying from jiggers. We get reports of people unable to work because of jiggers. We get reports of children not going to school because of jiggers. So when we approached, we come and assess the situation. Indeed, when we confirm that people are severely affected outside our area of focus, we come and support them in terms of treatment and telling them to improve their living conditions. And indeed, the results are very amazing. Many people are back to work. Many children are back to school as per the testimonies from the head teachers of the schools in
Teko Veronica, her mother and 3 children were rescued from a verge of their death as a result of the severe jiga infestation. To make matters worse, their garage thatched house collapsed 2 years ago, rendering them houseless, but leaving them with the roof that acted as their temporary shelter into which they crawled. Ifortrode has embarked on building for her a new house.
This jiggers started affecting me after some time. I used to go for firewood. I don't have shoes to put on. You find that the thorns prick my legs. When I come back from firewood, because of the thorns, I come to this dirty environment where I am. You sleep hungry like that, up to the next day when you're able to go and look for something to eat. My mother is very blind. I am the only person who is supporting all these people. But it's because of this Zika infection that has really made me fail to even construct a small house for them. We are residing in this house. When rain comes, we are beaten up at night, but there's nothing I can do.
While pregnant for her second child, Fatuma Akulo, 21, could not attend antenatal services as all her feet had been eaten by jiggers. She would only crawl in and out of the house, yet she had a baby to care for. Thank God, unfamiliar with Karamojong men, her husband took up all the roles of domestic work until Ifortrode rescued her. She was subsequently able to go to hospital for a normal delivery of her baby.
When the Ifortrode team phoned me that time, I was really badly off. I was just crawling. I could not even go for antenatal. I was pregnant by that time when the Ifortrode team came to help me. I could not even help my own children to cook. I was even not able to go to the borehole. Even moving out to visit friends, I could not move. I was just scrolling at home alone. My life has changed. It is not like the way it used before. Before I could not sleep because of diggers. My husband used to help me a lot. He used to cook for the family. He used to fetch water. You could even go and fetch firewood from the bush. When Ifortrode came, they helped me a lot. They treated my feet. They also gave me some first aid. Right now, you can see I am very okay.
Podoconiosis is one of the endemic diseases affecting people of Napak. Agnes Lutuke, 41, is one of the cases of podoconiosis. She says it all started with swelling and itching of her legs, but later started developing hard skin and swelling, killing her sense of feeling. She is extremely pleased with the help provided by Ifortrode as the swelling and itching has reduced.
It started from Iriri, where I'd gone to stay. When I came back to this place, my legs got swollen, and also where the head started aching me. I could not eat. It removed appetite. I have improved. There is some improvement. My legs have reduced. They used to swell. I can even walk.
People initially had all sorts of perceptions about this problem of, the lower limbs swelling, getting so much deformed, getting ulcerated. They attributed those things to witchcraft, maybe having stepped on somebody's gardens or somewhere. Those were the kind of myths that they had. And because of those funny perceptions, they had kind of tried to accepted that it's maybe that's the problem. That's the cause of the problem. But now that we know, we can be able to treat the problem of podoconiosis, and we have made sure that our health workers, the clinical teams on the ground, are very knowledgeable about what they should do when they come across such people. And we have also now taken it up as a priority problem. We would like to gather enough information about it. We want to see, we want to quantify the problem in the population. So we are monitoring the trends of this problem, which was not the case before. It was some kind of a neglected health challenge. So you can imagine that is the journey we have moved with Ifortrode. I think in a duration of about 2 years, we have achieved quite a lot as far as controlling very unique health challenges, which were actually burdening our population.
With tears flowing on her cheeks, Alice Lokuyo, 75, a resident of Nangororo Naitakwe Parish, lacked words to thank the Tungiasis health team from the Ifortrode who have been treating these people for the past 2 years.
I wish I even knew where these people were. I would even think, how did these people come here? Sometimes when the team of Ifortrode goes for all days, what comes to my mind is, where are these people? Should I even board a car so that I can thank them for coming to help me?
She said there are many organizations trying to help them, but Ifortrode's efforts have yielded results as the entire village is happy. She asked God to strengthen them further so as to help more Karamojongs.
There is a very big change in my life since Ifortrode came to this area. You can see even today I am really very grateful about Ifortrode. I thank Ifortrode for coming to rescue me. By now I would be dead. Even this meeting today, even to speak to you people, I was not able to move from my home. I could not even walk. I was just scrolling and sitting. When Ifortrode gave NIDA to the VHT who was helping me from this village, unfortunately she got a problem. Her husband was shot by the raiders at night and she took the husband to the hospital. That is why you can see a few jiggers have tried to enter my feet, but that woman was helping me a lot. And even the community, when they see me now, they can say, yes, that medicine is working. We thought it's not working. They are even happy. They are very happy about the Ifortrode. Thank you, Ifortrode, for coming to change my life. Thank you very much.
I would like, on behalf of the district local government of Napak, express our appreciation to you for the significant support that we have received to try to respond, first of all, to the Jiga problem. And in the process of addressing the Jiga problem, we realized actually that there are other issues that we could possibly take action. And so we hit so many birds with one stone. So the support from Ifortrode has been able to address a number of public health challenges that we are struggling with. With the support from Ifortrode, we have been able to actually almost eliminate that problem of the jiggers. And I am even very surprised that the intervention was so accurate. The specialist really gave us the right diagnosis, and everything was addressed quite well.
Akulo Luru, the chairman Nagulu Angololo F village in Nagulu Angololo parish, says that jiggers are a big problem in his area. All the families affected by jiggers. They had given up on jiggers as they thought it was a curse from the gods, but Ifortrode has demonstrated that jiggers can be cured.
Before this organization came, the people who were unlucky died. But when the organization came, those ones who were lucky, they were treated and they are now okay. No one has died when this organization came.
Regina Luolem, 53, testified as she was one of those seriously affected by jiggers. She joined Ifortrode as Tunjasi's health team. She says jiggers is such a big problem in her community that they reached a point when they gave up on treating them because no matter what they tried, jiggers would still infect them.
My people were really smelling because of jiggers. When Ifortrode came, they organized a team from the sub-county. They came and looked at the situation in my village. Some of them died. There's an old woman we lost because of jiggers. The jiggers entered her buttocks, the mouth, every part of the body. In that she could not even walk. She was not able to eat. She was really smelling. Right now, the situation has changed because of Ifortrode. Because before Ifortrode came here, people were suffering. They were unable to walk. Right now, the life of my people, they are very okay. The feet is really okay.
Rose Nakot, the head teacher of Nagule Angololo Community School, explains that their pupils could not concentrate in class as they are busy rubbing their feet all the time due to jiggers. Other children could barely walk to the school because of the pains.
The children were really suffering. Some children were not even able to come to class because they failed, because their legs were swollen. Even the hands, they cannot even able to write. They just remain in their villages there. They fail to come to class. Even some who are able to come in class, they were not attentive because they keep on stretching their hands and also were not able to write because of the interference of jiggers. So from there now, I think it has really improved. Like example, some of my learners who have just gone in class there, they are now able, but last time they cannot. Like there are some children who have been left with their grandmothers because their parents go to there are some districts to look for jobs because of anger. So they leave those children now. From there, their grandmother cannot even help this child to remove jiggers. So now, since they are helped now, they can now able to come to class. They can now write. They are even healthy. They can even run. When you bring them for PE in here, they cannot even manage to run or to do any activity. But now they can do something.
While fighting to restore hope to the people, the Ifortrode health team encountered a number of challenges, ranging from the people's poor social attitudes and practices, poor housing, to lack of security in the district. Proskovia Mukobe, as a project nurse, she says besides jiggers, the locals are often faced with malaria, respiratory tract infections, skin diseases like ringworms, and intestinal worms. She treats what she can, but those severe ones are referred to a health center or maternity hospital.
A number of health problems that people are facing. One, jiggers, malaria, eye problems, skin infection, for example, scabies, septic wounds with absence, language barrier. Since I'm not a Kejon, I feel difficult to talk to these patients. I bring the translator to translate.
Out migration. You'll find that most young girls always move to Kampala, they go to Busia to look for this casual labor. Because you'll find that there's nothing to be eaten at home. The girls move up and down. When they come, they reinfect others.
When you're helping someone, she's thinking, we find it a bit hard to help them, but we have a spirit that our people should have good health and also be able to move in order to help their families.
Some of these people, for them, they think that having jiggers is normal. So to change their minds really is difficult for us because they say the drug we are giving, the drug we are using to treat the jiggers, they say that it has side effects. It will affect their movement. But as we team, we try to convince them.
The diseases have persisted because of lack of water, which is key to proper hygiene, as one borehole serves the whole parish, and thus people have to choose between consumption and washing.
You will find that in a parish, we have only one borehole, and yet we have a population of like around 2,000 people, 2,000 to 3,000 people, and yet they have only one community borehole. And yet this work is not effective without water. We can't do it. You can't give treatment without water. Though you put it when they have not washed, the medicine cannot work.
Sometimes those water sources are actually stressed because they are not only serving the populations. Human beings are sharing water sources with herds and herds of animals. So ideally you find that probably the functionality of those water sources is an issue at the end of it all. They easily break down, and it takes long probably to find the spares, something like that. So all those factors influence availability and access to clean and safe water. The issue of water is very crucial and key in addressing most of the public health challenges that we are struggling with as a district healthcare system.
Michael Banaliachi, the sub-county team leader, says that at the time they started treating these people, over 70% of the community people were affected by jiggers, and many were dying from jigger-related illnesses like anemia, lack of appetite, among others.
We actually found out that scabies was also a very, very big problem, most especially among children, and also women, and also the elderly. The men and adolescents or the youth were mostly not affected by scabies because they look to be maintaining a little bit of more hygiene than these other age groups. A lot of fungal infections were common. We also encountered a lot of, according to the season, malaria is also very common. Then most especially children also have a lot of eye problems. But we also have quite a number of patients that are suffering from podoconiosis, that disease which is usually commonly called elephantiasis. We've been actually telling people to simply sweep their houses on a daily basis, take out the dust, because the fleas that cause the jiggers survive mostly in the dusty areas. You maintain the dust, you've called the fleas.
The most percentage which is affected is the elderly and the children. However, we've looked for different means as an organization, and we've helped out those people, the elderly and the children. And when you look at them before and then after, there is really a great change, because some of them are free from jiggers and others are remaining with few cases.
Dr. Francis Mutebi, a researcher but of veterinary background on the Ifortrode team, says that there is need for a holistic approach to intensify health education to the community, improve housing, treat animals that would spread fleas, and also treat the people infected by jiggers and other illnesses.
We do health education, we treat animals, and we treat people. With that, we are able to tackle the jigger fleas from all directions. We want the community to improve their living conditions by bathing daily. We are advising them to bathe at least 3 times a day, although one of the biggest challenges is that the water sources are far from where many houses are located. We also tell them to smear their houses. That will help to eliminate jiggers which are in the environment where people live. Also, animals are known to be infected by jiggers, so we examine animals for jigger fleas and we treat them in addition to treating humans.
The jigger problem is not only in Napak but also other parts of the country, and thus a need to intensify stakeholder involvement. Dr. George Mokone, the director of Ifortrode, says that the project was initially planned to be implemented in Jinja, but a pre-implementation survey showed that Jinja had a low prevalence of 7.2% compared to Napak at 68.9%.
We had initially identified jiggers as one of the most neglected tropical diseases. And initially we had thought it was Busoga which was being affected most. But later on we realized that it is actually Karamoja as a region is more affected. We did a quick survey in September 2019, and we discovered that here in Karamoja the prevalence of jiggers was actually in their 70s, as compared to 70%, over 70%, as compared to Busoga, which we had initially intended to go into. It actually had 7.2%.
Dr. Mubanguzi is grateful for Ifortrode's efforts to fight the entities in Napak as private partners with the government, and also asked them to spread to other areas of the country that are also affected amidst a number of challenges they face, especially finance, and also called upon all well-wishers and able persons to give a helping hand to Ifortrode to champion the elimination of the diseases.
Jiggers has been a very big problem in Karamoja. I want to thank the Ifortrode, Innovation for Tropical Disease Elimination. They have really helped us. I myself, I have been there. I have seen what they are doing. I have interacted with the community, and really they came up with a very good innovation. I have visited the Manyata with the director of the Innovation for Tropical Disease Elimination, Dr. Mokone, and I have seen how actually they have saved those people's lives. Yes, because I have seen they have helped us, they have got the medicine which they apply on their body, and actually it kills those jiggers. They have helped them also to improve their hygiene. Call upon the government support some of these partners who have gained experience and they know how to handle the community, and they have used the public health intervention experience in the public health actually to control these diseases.
This humanitarian project is supported by the Fresenius Foundation in Germany, and our overall coordinator is Professor Hermann Feldmeier, who is a renowned researcher in neglected tropical diseases. It was actually born out of our various collaborations in research, which found out that the disease is widespread and has had big toll on the livelihoods of the people.